Victoria has recorded 1 death and 216 new coronavirus cases in the past 24 hours. Premier Daniel Andrews says a man aged in his 90s has died overnight. Reporter Danny Tran joins us now from Melbourne. So Danny, just give us the breakdown on those numbers that we've just had come through this morning.
Miriam, it was the news that Victorians have been bracing for another triple-digit day in coronavirus infections. 216 new cases, and very tragically a man in his 90s died overnight, taking the death toll to 23. There are 186 cases under investigation, 30 cases linked to known outbreaks, and 49 people in hospital today.
And Danny, what's the plan going forward with testing to try and halt the spread of the coronavirus? Well, Victorians have been agreed to be tested more than 1 million times. That figure's just ticked over, which is a huge achievement for the state. There are currently 150 testing sites, but the government says that the plan is ultimately to have a testing site within 10 kilometres of everyone, so that no matter where you are, you can reach a testing site relatively quickly. But in addition to these testing sites, the advice around masks has also changed, and that came through earlier this week. Throughout this pandemic in Victoria, people haven't been wearing masks. That hasn't been the official advice, but that's since changed because the studies now show that it can have an impact on preventing the coronavirus from spreading. Here's what the Premier had to say about that a little bit earlier.
Just got to be really clear about this. It's not compulsory, but where you are out for a lawful purpose and you believe you may not be able to maintain that 1.5 metre distance from other people, then through an abundance of caution, and it's a low cost, high reward. No mask is foolproof. No mask will get the risk of infection down to zero, but every little bit helps. Every contribution helps.
And Danny, when might we expect to see some results from this current phase of lockdown stage 3 for Melbourne and also for Mitchell Shire, and of course the extra testing that we're seeing?
Miriam, we just heard from the Premier and he said that there has been some change. Sorry, the Chief Health Officer said that there had been a behaviour change before lockdown, and as a result of that we're hoping to see some form of plateauing within the next few days, and then hopefully greater changes within 3 to 5 days after that. Look, it's something that Victorians are now used to. This is the second lockdown we've been through, and as the Premier's made clear, people know the rules, people know what's correct to do and what's inappropriate to do. And he's urging people that if they have the slightest symptoms to get tested, and if there's any issue, then follow the 4 rules. There should be only 4 reasons to leave your home: work or study, exercise, the provision of supplies, or medical care.
Reporter Danny Tran there from Melbourne. Well, now looking at the situation in New South Wales, where 7 new cases have been recorded. This follows 3 confirmed cases, one of which was a man who travelled from Melbourne to Sydney towing a caravan. He is now in self-isolation. Reporter Jessie Dorset is in Casula in southwest Sydney, where the other 2 cases have been connected to the Crossroads Hotel.
This is the pop-up testing clinic at the Crossroads Hotel at Casula in Sydney's southwest. You can see dozens of people are here doing the right thing, heeding the advice of authorities to get swabbed. Now, the venue has been temporarily shut down and there are about 10 contractors inside doing a deep clean. That's after a woman in her 30s and a man in his 50s both tested positive to COVID-19. Now, they don't know each other, but they were here on the same night, last Friday, a week ago. The people we've spoken to who are waiting to get tested say they're doing it for themselves and their families.
No, I've been here about an hour and a half waiting, but it will happen. Just be patient.
This is my local, so I was here on the Friday, so I'm just coming to get verification everything is okay.
Just doing the right thing and ruling out all possibilities.
New South Wales has recorded 7 new infections overnight. One is the man from the Blue Mountains who was here at the Crossroads Hotel a week ago. 3 people who had close contact with him at home have also contracted coronavirus. They're all now self-isolating. Authorities say New South Wales is at a critical point in the fight to contain the virus. More than 1 million swabs have been taken across New South Wales since the pandemic began. But of course, now's not the time to slow down the testing. Extra resources are being sent to places where Victorians likely are. Places like the border communities, Albury, Wodonga, the New South Wales snowfields, Ballina and Byron Bay.
The Therapeutic Goods Administration has approved Australia's first treatment option for coronavirus. Remdesivir has been approved here and is already a treatment in the European Union, Japan and Singapore. Political reporter Anna Henderson joins us now. Anna, just who will be able to access this new drug?
Well, Miriam, the Therapeutic Goods Administration made this announcement overnight and says that this drug will be available to adults and teenagers who are suffering extreme effects of coronavirus. So people who require ventilation, who are in ICU, they will be able to access this drug. There has been some discussion internationally about supplies of this drug and whether or not the United States has taken up quite a bit of the available supply, and also whether or not this drug is providing through the clinical trials enough of the evidence required to prove that it is an effective drug to use for coronavirus. But certainly there has been a lot of positive reaction politically. This is Jim Chalmers from the Labor Party, the Shadow Treasurer, and this is his view on this therapeutic goods announcement.
I think it's really important that this drug has been approved for treatment, because treatment will be such an important part of what's necessary here in the absence of a vaccine. We want to make sure that the government has sufficient stocks of this important treatment to deal with what has been a spike in cases in Victoria. Until and unless we have a vaccine for COVID, these kinds of treatments will be extremely important.
Anna, have there been any concerns expressed about its use?
Yes, well, as I mentioned, there have been some discussions internationally about the use of this drug and also whether or not there's enough of a supply. We did hear some interesting comments from the Victorian Chief Health Officer, Brett Sutton, in relation to this news overnight. This is what he had to say.
The Victorian clinical community will look to Remdesivir as a therapeutic option. If it's on the Australian Register of Therapeutic Goods now, they will love to have it available for them as they have used dexamethasone, that powerful steroid that's been shown to have a genuine effect on mortality rates. So Remdesivir is another drug that's shown some effect, possibly not as strong as the simple and cheap dexamethasone steroid drug, but it certainly has a role and seems to reduce the amount of time that people are ill for and require in hospital.
How much of that drug do we actually have in Australia or Victoria? I don't know if you know.
I don't know.
The US was stockpiling it.
Yeah, I don't know. I know that the Australian government has looked to get its own supply, but the US really went very hard in gobbling up the entire global supply almost.
Now, Anna, in a separate matter, the federal government is also facing some heat over its decision to end the free childcare provisions it put in place due to coronavirus. Are parents prepared for the changes?
Well, we've seen some commentary over the past few days about whether or not parents will be able to afford it once this free childcare provision is no longer in place from the coming week, and also whether or not some of those childcare services are going to get into some trouble because they won't be able to afford to pay all of their staff if they have a drop in revenue. So some serious issues for the government to deal with as the next week unfolds. But of course, at the same time, we've heard many times from the Treasurer and the Prime Minister that some of these measures put in place for coronavirus were incredibly expensive to the federal budget and do need to be more tailored. Now, Shadow Treasurer Jim Chalmers was speaking on this issue as well today, just raising concerns about how this is all going to unfold.
Our concern is by kicking childcare workers off JobKeeper and not making the new arrangements sufficient to deal with that a lot of parents will have to make very difficult choices. The Prime Minister says that we're all in this together. Well, if that is to be more than a slogan, then he needs to recognise that some of the decisions that the government has taken have made life even more difficult for people during this crisis, including working parents who had it tough enough before.
So, Miriam, there have been special provisions put in place in Victoria in areas where the lockdown provisions are continuing. But in terms of the rest of the country, there's still a lot of people who have either lost their jobs or had reduced working hours who now have to find the money to put their children back into childcare. And that's a political issue that no doubt will be raised with the government many times in the coming week.
Our political reporter Anna Henderson there from Parliament House in Canberra. Now, authorities are stepping in to control the coronavirus outbreak in Victoria and stop it from spreading into New South Wales. Ashlee Aldridge is at the Albury showgrounds on the New South Wales-Victoria border, and it seems it's a bit of a wet morning there as well, Ashlee. Now, the number of tests in Albury-Wodonga has increased in the past few days. How is New South Wales dealing with the influx?
Yes, that's right. Just this morning, a new testing clinic site has been opened here at the Albury Showgrounds. Now, it replaces a smaller clinic which was opened at a community centre earlier this week, which came after New South Wales Health issued an urgent message to locals in the Albury and Wodonga area, urging anyone who is experiencing even the most mildest of symptoms to get tested. Now, since that initial clinic opened on Tuesday, more than 900 people have turned out to be tested, and they're expecting around another 200 people to come here today. We're already seeing a stream of people turn up to be tested. We spoke with the Murrumbidgee Local Health District's disaster manager a short time ago. Here's a little bit of what she had to say.
We're still seeing large numbers. In the last week, we have tested 900 or thereabouts people. So we then work through the week to identify a new location, and we'll be set up here for the next couple of weeks, operating from 9 a.m. to 4:30 p.m.
Ashlee, there are now 3 positive cases for the Albury region. What have local health authorities had to say?
That's right. Earlier this week we learnt that 2 people had tested positive to COVID-19. Of those 2 people, we know that one of them had recently travelled to Melbourne before those hotspot restrictions were reintroduced. Now, they are from the same family. We've since learned that a 3rd family member has also tested positive to COVID-19. Now, we haven't had a positive case here for more than 100 days, so local authorities have really sought to reassure the local community that this isn't the case of a new outbreak, rather it is an isolated cluster. They say that it has been contact traced back to Melbourne, and this family has had little contact with the local community.
Now, it's also day 4 of the border closure there. Are there still significant delays for those trying to cross from Victoria into New South Wales?
We haven't seen those chaotic scenes which we did see in the initial few days of those closures. They've made a few changes to those main checkpoints. On the Lincoln Causeway, they have extended it to 2 lanes, which has really helped with that traffic congestion. And out on the Hume Freeway during peak hour times, they're also allowing cars to be checked, which has really significantly reduced that time waiting for people to cross through the border. That 72-hour grace period, which New South Wales Police said that they would give to people trying to cross the border, has now come to an end. So locals looking to cross the state lines from now on are really being urged to have their permits ready to show authorities, or risk being turned back into Victoria.
Our reporter Ashlee Aldridge there from Albury. 2 Defence Force personnel who recently returned to Queensland from overseas have tested positive to COVID-19. Health authorities say the pair has been in isolation since their arrival, and there's no public transmission risk. It brings the state's total to 1,070, with 3 cases now listed as active. It comes as the federal government confirms it will cut more than half of the number of flights into the country, with states and territories to begin charging returning travellers for the cost of hotel quarantine.